Now we're looking at a view of an assembled pelvis where we have the two hip bones, the sacrum, and the coccyx. And our take-home messages from here would be that the pelvis is divided into a false or greater pelvis, as well as a true or lesser pelvis. And there is a dividing line or an anatomic landmark that helps us to make that regional separation. We'll get into some of the details of this landmark here shortly, but for now, this landmark is referred to as the linea terminalis. And we see that running from here, along the sacrum, coming back to the opposite side to join up in the anterior midline. Anything above that, so anything spanning between the ala of the ilia, anything above that, superior to that linea terminalis, that will constitute the false or greater pelvis. This regionally is a part of the abdominal cavity. The area below the linea terminalis, so inferior to that, this region represents the true or lesser pelvis. Greater and lesser designations being used to describe this overall size. So your true pelvic viscera will reside within the true pelvis. The true pelvis has two openings, an inlet and an outlet. The inlet is where you have your linea terminalis, and then the outlet would be the area located inferior to that. The next slide helps us to have a better understanding of the landmarks that describe the pelvic inlet. And specifically, we'll have the sacropromontory here posteriorly. And if we go to the left here, we will find the ala of the sacrum. That will then continue along the arcuate line, come around anteriorly, continue as the pectineal line, go to the pubic tubercle, go across the midline, and come to the opposite pubic tubercle, follow the opposite pectineal line to the opposite arcuate line, along the opposite sacral ala, and then back to the midpoint along the sacral promontory. This area is demonstrating the pelvic inlet. The pelvic outlet is shown here, and so the pelvis is tilted, as you can see in this view. And here we're looking at the inferior aspect of the pelvis. And the opening that we see here in this inferior view constitutes the pelvic outlet. It is somewhat diamond-shaped in appearance. And the boundaries of the pelvic outlet anteriorly would be the pubic symphysis, and this is where the two pubic bones will form their articulation. We also have the ischiopubic rami. This would be the joint rami that are formed between the inferior pubic ramus and the ischioramus. So that would be along here on this side and along here on this side. We will get then to the ischiotuberosities on either side. And then we have some prominent ligaments on this side and this side. Those are the sacrotuberous ligaments. And then in the posterior midline, we have the coccyx.